Hello, hello, hello. Once again, Happy New Year. It's 2022. We are back. This is still season 3. I know it's the new year, but we're still in the middle of season 3 of Mind, Your Body, and Soul, the healthiest podcast you've ever heard in your entire life. I am Joseph Ward. I'm riding solo today because my co-host Mathias, he has a lot to do. It's a lot of COVID testing and a lot of just normal clinical things that he has to do. So shout out to Mathias. We're gonna do our best to hold it down with you not being here, but good luck in the clinic. Um, Remember, Mind Your Body and Soul is the healthy podcast hosted by myself, Joseph Ward, and Mathias Sweet. And this is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, we're available every Wednesday on our website at www.nmcpodcast.com, as well as our parent website at www.neighborhoodmedicalcenter.org. We're also available just for podcast platforms on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and YouTube. Make sure you subscribe to our YouTube channel. We need more subscribers, more that help the algorithm get out, and it helps more people get access to this wonderful information that we've had. Thank you to everybody who's been a part of Mind Your Body and Soul podcast from day one to now. We've been able to grow. Our statistics show 50% growth in viewership and listenership. So thank you to everyone who's been supporting this podcast. And we have another good one today. So about a month or so ago, Neighborhood Medical Center, we partnered with Florida State University and Tallahassee Memorial Healthcare. We provide vaccines for our community. We're one of the many sites who provide vaccines for our community. But this particular vaccine clinic was different for a good reason. So when I got to the building that Saturday morning, I learned that we will be partnering with music therapy to help the children. So at first, I'm trying to picture it in my mind. No judgment, no expectations, just trying to picture it in my mind. I'm familiar with music therapy on the surface level, but not necessarily in theory and in practice. I'm not familiar with music therapy. So that was something that I was looking at as, okay, this is going to be very interesting. So we start to do our vaccines, and we have a number of young children. So from the ages of 5 on up. And usually when you're talking children and shots, children are not fond of shots, right? But when I say this was one of the best experiences I've seen with children and shots, because the music therapy helped the children stay calm. The music therapy helped the children's anxiety levels lessen before the shot, during the shot, and after the shot. Because usually you'll see a child, they're very anxious about getting shot, and they're like, I don't want to do this. They're running around the offices, they're doing this, they're doing that, and all those things are going on. So the children were calm. The children were in a state of, it was tranquility everywhere. The music was good. The environment was great. The collaboration was great. And I said, you know what? More people need to know about this music therapy. I'm sure there are a lot of people, but those of us who don't, let's learn more about music therapy. So our guest today, I know that was a long intro, but I had to say it because I like to want to make sure I give props to people who deserve it. Florida State University, the music therapy program, especially Tallahassee Memorial Healthcare. Thank you, thank you, thank you. So our guest today is Dr. Lori Gooding. She's an associate professor of music therapy at Florida State University. Her primary clinical work has been with medical and mental health populations, and her research has focused on using music therapy to address psychosocial needs in medical and military-connected populations. Dr. Gooding currently serves as the president of the American Music Therapy Association. So all my people in podcast land, yo guys, put your hands together and put your headphones on, put your thinking caps on, and whatever your favorite melody is, let it play in your head. Dr. Lori Gooding, welcome to Mind Your Body and Soul.
Thank you, Joseph. That I'll take those shout outs anyway for music therapy. That was awesome.
Yes, like I say, the event it was amazing. It was, like I said, I had no expectations, but if I did have expectations, it would have exceeded my expectations because the the way the children receive you guys was amazing, amazing.
Yeah.
So thank you again for all that you do, and bringing music therapy to our city.
No, it was our pleasure. And the really great thing about something like music therapy with vaccinations, and we call it procedural support, is that
Hmm.
it helped those kids. It helped the moms and dads that were just as anxious, if not more so, about what was
Right.
about to happen with the kids, and it helped you guys. So we really value the opportunity to be able to impact so many people at one time.
Yes, yes, yes. And for those, if you haven't seen it, there's actually a snippet video floating around on there. It's on the Neighborhood Medical Center's Facebook page and Instagram, but it's going through the internet, and it's showing that experience of that Saturday. So go check that out. So
Great.
so we want to learn more about you in music therapy. So, Dr. Gooding, could you give us some background information about yourself, and what was the inspiration that spurred you to work in mental health and music therapy?
Right, right. So I grew up in South Carolina,
Okay.
and I have a younger brother who was in an accident as a child, and that accident was pretty substantial, and it involved a lot of physical therapy and hospital visits and surgeries and all kinds of things. And so for me, music was the place where I didn't have to really deal with all of that,
Okay.
because he was 9, I was 11 when it happened, and I was already playing piano, but then went into junior high, got into band, and music was just it was very much a coping mechanism for
Hmm.
me. It was a space to be me and not have to deal with everything that was happening, in our lives, which was a lot, and understandably so. But at 11, 12, 13, I needed a place to just be 11, 12, and 13.
Right.
And so music was that for me. And I just so happened to also go to church with my junior high band director. And so as I got into high school, and because she had that kind of dual relationship with me,
Hmm.
it's a really small town of 8,000 people. So there was, you went to church or wherever with your
Right.
teachers and everything. It was totally the norm. Um, she said, "Hey, here's this profession that I think you would be a really good fit for." And so I started looking into it. This was back in the early 90s.
Okay.
And at that point in time, nobody knew what music therapy was.
Right.
It was just not something that people had heard of, or at least widely so. And I thought, well, not so. I'm not sure yet. So I went in. I did my undergrad degree in music
Hmm.
education with kind of the thought that I would either do music therapy or go to med school.
Right.
Uh, and if I had gone to med school, I would have gone into psychiatry. That was the
Okay.
area I wanted to do. So that interest in mental health was there already.
Oh, gotcha.
Um, and I decided to pursue music therapy. I wasn't ready to give up the music side. I knew I wanted to help people,
Hmm.
but I also knew that I really wanted to stay connected with music. And music therapy was a helping profession that used music, so it allowed me to do the things that I really valued.
Right.
So I came actually to Florida State and got my master's. Went on to work and started out with older adults, and then moved into mental health, and then from there into medical, and then eventually came back and got my PhD again at Florida State, and spent 5 years in Kentucky working there in academia and in medical.
Hmm.
And then a job opened up here at FSU, and I was able to come back, so come back home, so to speak, and
Right.
I've been here since 2015.
Okay.
But for me, it was just that connection with music is something that I valued, that I enjoyed, but also a place where I got to be me.
Yes. I understand. For me, two places that is for me, and my driver's seat in my car, and I like to. I guess it's the acoustics in the bathroom. So you're in the bathroom, you're getting ready, and you have your
Absolutely.
music, and everybody's an American Idol in the shower.
Amen. Amen.
So, but I understand what you're talking about being able to escape within the music and find a place of solitude and peace, within the music.
Yeah, yeah. For many, many people, music is a coping strategy. It's also a great way to express yourself, and you can do both of those at the same time, which is
Right.
even better. So
Right. So, how did you learn about Florida State being from South Carolina?
Well, because my band director had known about, she knew schools that had it, so she was
Okay.
able to kind of to clue me in. And
Okay.
at that point in time, there were no graduate degrees in South Carolina. They actually still aren't at this point. And I was able to go through the academic common market, which allowed me to have in-state tuition
Oh,
at
gotcha.
Florida State, and so it was one of the places that was most financially viable for me to be
Okay.
able to do as a grad student, footing it on my own. Not from my parents or anything. It was tight, but it was doable. So that's how I
Gotcha.
found out about it.
Okay. Okay. Well, and that's great because the teachers and the staff and the adults around us are the ones who should be helping to push us to these places. So that's great that you
Absolutely.
had that adult there saying, "Hey, check out these programs," and also paying attention to you and your interests. No, understanding you have an interest in mental health and music.
Right.
So that's
Right.
that's amazing.
Yeah,
So,
as a teacher now, albeit a professor,
mhm.
I totally believe in the value of the role that those teachers play in our lives,
Yes,
and teachers
yes,
have been some of the most important people in mine.
yes, yes. So, I, a lot of people believe they have an understanding of what mental health is, or just psychology or psychotherapy, all these things. But could you help us get a better understanding of what mental health is, and how a person's mental health actually affects their behavior?
Right, right. As a music therapist, I really take a holistic view to mental health. Some
Hmm.
people will say it's well-being. Some people will say it's a dynamic kind of a state of equilibrium. And there are merits to all of those different viewpoints. But for me, mental health is, being able to be resilient.
Hmm.
It's being able to have the skills that you need to function in your society,
Hmm.
because there are different cultures. And so what is a healthy state of mental health might be different based on some of the cultural norms where you are.
Right.
But it's having the skills that you need to really be productive and contributing to a society in a way that's meaningful for you,
Okay.
um, and be resilient when you do face challenges. I don't think mental well-being is the absence of mental illness or the absence of challenges. I
Right.
think those are a normal part of what we all experience. And so really, if you come at it from that holistic place of, you know, making sure that I have the skills I need to get through the tough times and to be able to express myself and function when there are challenges and get back to the state that I want to be in. To me, that's really what mental well-being is, mental health is.
Right. Right. And as far as like, are there, I guess the severity of, if a person has some kind of mental health issue, I guess it would be the severity of it, or um, I guess trying to find the best way, but what determines how impacted the person is by the whatever
Right,
mental health issue they're dealing with?
right. You know, I think there are a lot of things that impact your mental health and your mental well-being. You can certainly have a diagnosed or a diagnosable mental illness,
Hmm.
and there are a number of different factors that can lead to mental illness. You can also be experiencing a lot of challenges. You can have experienced trauma or neglect or injury. All of those things can contribute to your mental health. And then, in the way that you kind of think about the world and move through it can also experience it. So
Right.
there's some environmental, there's some biological, there's some psychological factors that all contribute to what really is our mental state.
Okay. And just one more question on that. Is there and this is just something that I've been thinking about, because doing outreach here at Neighborhood Medical Center, we spend a lot of time in the communities,
Right?
especially underfunded communities, underserved communities,
Underserved.
and I see a lot of people, especially in my community, see a lot of people who are walking down the street, and you can see they have mental health issues because they're having arguments or conversations with certain people, and obviously, great trauma contribute to something like that. But could you kind of speak on how traumas that people may overlook or people may even minimize, how those could possibly add up to contributing to somebody's mental health state?
Oh, absolutely. I think it impacts it in two different ways. So, you know, when we're facing a lot of the different, for lack of a better way of saying, like the isms, so racism, sexism, things like that, that can impact us on a day in and day out basis, that can create an environment where you're under that constant state of stress. And that is going to have an impact on both your physical and your mental well-being.
Right.
And so it can lead to physical conditions, it can lead to mental conditions. And when you pair that with areas where you're under-resourced, whether it's economically challenged areas or rural areas where there might be one doctor. As I mentioned earlier, I grew up in a town of 8,000 people.
Right.
I'm not a mental health issue, but I needed braces. I had to drive an hour plus away just to get braces because we didn't have anybody in this town of 8,000 people that could do braces. So when you either don't have the financial resources to access, or there's literally no access because of where you live, when you compound that on top of the cultural aspects, the social aspects, the ongoing lack of socioeconomic resources and that sort of thing, that really creates a situation where your mental health can suffer.
Yes. So my co-host Mathias has popped in. Welcome,
Hi, Mathias.
We know you're busy out here. We know you're busy out here doing a lot of COVID testing, but Dr. Lori Gooding, this is my co-host, Mr. Mathias Sweet. He's the director of our Ryan White HIV/AIDS prevention program.
Hey, how you doing?
Hey, good. It's nice to meet you. You're still in your clinical garb, I think, there.
Yes, I'll be running in and out, so I'll be, hopefully I'm on a little break right now, so that's the good part.
Yes. So Mathias, welcome. Go ahead. You got the next question, my brother.
All right. What are some internal and external factors that can negatively affect a person's mental health?
Yeah, that's a great question. I was telling Joseph earlier, he asked some really great questions. So you guys are really good. I'm thankful for that. We mentioned some of those, but broadly speaking, you can think about mental health in the different factors that impact it. You have biological factors, you have psychological, and then you have environmental factors, if you kind of want to think about it broadly. And the true answer is we don't have definitive information on what causes mental illness.
Okay.
But what we do know is it's likely a combination of those different kinds of factors. So biological might be genetics. You tend to see situations where if a parent has a mental illness, then a child might be at greater risk of a mental illness. But biological can also be something like with the military populations that I worked with, they've had traumatic brain injury as they're serving. And so that has caused damage to the brain, and that impacts their mental health. So you have that aspect. You have the psychological factors in terms of how we move through the world, how we think about the world, some of the experiences, support from families, emotional resilience, your ability to regulate and process and express your emotions. Those things can contribute as well. And then some of the environmental factors, it can be environmental in the literal sense, like your location. So if you're living in an area where there isn't access to healthcare, that can negatively impact you. But they can also be environmental in things like cultural aspects. If depending on what country or what city or state that you're in, there are going to be different cultural aspects that may also influence your own mental state and your health and well-being.
Okay, so I have another question.
Sure.
So, like,
her answers are great.
I know. So, like, working in like some mental health capacity, because I do work at some, with some mental health patients and stuff. How do you determine what is really behavioral and what is really a mental illness? As far as, because especially like with some children, you see, is that just behavior or is this really something going on? How can you, as a person looking in, be like, okay, this is really something going on, we need to get this child help, versus is it really just behavioral because I didn't get what I wanted today?
Right, right. I think there are some similarities sometimes, and then there are some differences as well. And that's where you really need a trained therapist to come in and identify what's going on. We in music therapy, we call it a functional analysis. What's happening around this child that's really prompting or allowing those behaviors to happen. And sometimes it could be a normal developmental behavioral issue, and you're going to address that in one way, because we expect children to, do different things at different points, because that's part of learning and development.
Right.
That's really different, though, than that child that has a mental illness that may need greater supports other than just something like structure, for example, or rewards and behavior modification. They might need medication. They might need therapy to help them learn the skills that they don't have. And so a therapist is going to come in and look at, and really not just look at the behavior, but what all of the factors that are leading to that behavior, and then determine from there what the best strategy is to address it.
Gotcha. Yeah, that makes sense. Because just looking at all different type of factors, when I'm thinking about different factors that could go into a person's mental health state, it's amazing. It's a large plethora, but like you're talking about environmental, biological, those certain things. Like, how is it determined, or what screenings or what testing does a person go through? Because let's say, I'll use myself as an example. How would I know if I need mental health? I grew up in certain environments. I remember we knew when it was time to go to bed when we heard the gunshots outside. But also I played football, took a couple head injuries. So somebody like me who grew up in an environment where it was somewhat survival, but then also dealing with head-on collisions every day in football.
Right.
So somebody from my experience, how would I know to go get evaluated, or what's the process of getting evaluated with that?
Right. I'm going to give you some kind of transfer examples that might hopefully help with that.
Okay.
And I'm going to talk about this both as a therapist, but also as the parent of a child who's gone through those evaluations and actually has a 504 in the school system. So has been identified and gets support. So I've done it on the therapist end, but I've also lived it as a parent. And I think one of the things that was important for us was identifying what would be considered typically developing because he was a child when it happened.
Mm-hmm.
What would be typically developing, and seeing where he's meeting kind of those norms. And again, in a typically developing child, there's a range. So there's not just one thing that's typical, but watching out for what I should, broadly speaking, see as, you like to use the word normal, but on track in terms of development.
Mm-hmm.
And seeing where he varied from that. And then also watching for changes in behavior. And so, Joseph, I think that's for you with your experiences. If your 17-year-old self who's playing football and living in this environment that is at a minimum stressful, right?
Mm-hmm.
Am I starting to notice differences in the way you're moving through the world?
Gotcha.
And those differences are some of the first kind of signs that something might be happening. And so whether it's differences from what's expected developmentally or differences from the way you functioned before, that's what you're watching for. And then the process of the evaluation itself, is going to vary based on what might be suspected.
Right.
But typically it involves, medical workups in many cases, because there are some biological, physical conditions that can cause symptoms that look like mental illness, but it might be inappropriate vitamin levels or a tumor in a part of the brain or something that might be causing that. So I'm going to look at things like the medical side, but I'm also going to do evaluations for children, for example, in my own life, they asked my son questions, they asked the parents questions, we asked the teachers questions, and we compared the answers to see where his behavior was changing and when and why.
Okay.
So it's a really thorough
Gotcha.
process with the right kind of professionals. As a music therapist, I don't diagnose.
Right.
I assess for behavioral and planning, but I'm not diagnosing. So we worked with a psychiatrist, clinical social workers, things like that, to do the actual assessments.
Okay. And so speaking of that, could you explain to us how going through therapy actually helps improves people's behaviors?
Yeah. One of the things that I've always thought, and what I teach my students when I'm teaching about mental illness and behavioral disorders and things like that, is if there is a biological component, in other words, let's say there are certain chemical imbalances in the brain, right? As a therapist, therapy is not going to change what's happening in the brain in terms of those neurotransmitters and things like that. You're going to need medication to address those issues. But that medication can't teach you how to cope when you're frustrated.
Right.
So therapy is really the part of the process where you learn the skills, the coping skills that you may not have in your current way of moving through the world.
Gotcha. That's a
good
great
way.
Yes. That's a great way. You're learning new skills to cope and be able to process and exist in the environment that you're in.
Absolutely. And as a therapist, my goal is always to teach you something in the session that you can use outside of the session.
Okay.
It's great if you're functioning well in the session, but it's even greater if those skills are transferring outside and you're putting them into practice day in and day out.
Okay, so I'm going to say it like this to make sense to me, maybe others. So it's kind of like if I go to a personal trainer and the personal trainer says, well, they worked me out in that session and I want abs. And the personal trainer says, okay, well, on your own, eat salads twice a day and do sit-ups 100 times a day. That will be what I would need to do on my own. But I have these sessions with my therapist, but the sessions on my own, and those two combined will help me improve myself.
Absolutely.
That's a great explanation. I appreciate that.
Oh, you're welcome.
So with that being said, music therapy. Could you explain what music therapy is? We'll just start. It's kind of a 3-part question, so kind of break it down. Like, what is music therapy?
Okay. So music therapy is the use of music-based strategies and techniques by a credentialed or trained and qualified music therapist within the context of a relationship to help the client, the patient, the service user, we use different terms depending on the setting, to help them produce functional outcomes. So in other words, if you have a specific area that you want to improve, to increase, to decrease, to change in some way, we use music-based strategies to help you develop those skills that you need to function in a way that is more consistent with being who you want to be as you move through the world.
Right. Okay. And then, so does the type of music you as an individual like matter to the therapy session, or are there already scientifically proven specific types of music that may help over others?
Yeah, no, very much so. The type of music matters. There are some exceptions to that, which I'll go into in just a minute, but we have a substantial amount of research that shows that patient or client preferred music that you connect with, is going to be the most powerful. It's what's going to be most effective. And so because that music has not only connections in terms of what you like, there's connections in terms of familiarity. You use it more often. And there's also cultural connections that connect with you and culture in many, many different ways. So broadly speaking, but also in your individual family culture and life as well. So when you use music that people connect with, it's going to have more power. Now, the but with that is there are some exceptions when you're trying to accomplish certain things that you need some specific music factors. Like if I'm teaching you to walk again, I need music that's at the right tempo, because if you go too fast, you might fall and hurt yourself.
Right.
So there are some exceptions, but we try to integrate those within the context of the preference.
He probably go ahead. You can ask your question.
Okay, so I have a question. So I get the type of music that people can relate to, but what if it's something that is like negative and dark and like keeps them in that, and that part also is triggering them? But what do you do, or how do you, which seems like to me would cause more trauma, because it's talking about the negative things like shooting, killing, da da da, but they connect with it. So how would you use that in therapy if you're trying to work on those type of things and you're like paranoid or scared of those type of things, and you're listening to that because that's what you like, but it's also triggering things.
Right. So what comes into play here is that's where the part where I talked about within a therapeutic relationship is really important, because my job as a therapist is to use music that you connect with, but also help you process it. If you're looking at it from a kind of coping skill development standpoint, for example, to help you process it and really understand what it means to you, understand what it might activate or trigger in your own life, and understand whether that engaging with that music is actually healthy for you or not. And one of the examples that I use that I think that helps really make this clear is I talk about if you have a substance use disorder and there was always a specific kind of music playing when you drank, let's say you're an alcoholic, then engaging with that music might actually trigger those cravings to drink. And so we would potentially in a session listen to some of that music and help them understand what it's triggering for them, and then start to discuss, is that actually a healthy use of this music for you, or do we need to find different music for you to engage with so that it doesn't activate your craving?
Gotcha.
So we don't avoid music that might be connected with trauma or substance use or things like that, but we work through it and help them understand how they are connecting and relating to it, and then make choices on whether that's healthy in that moment or not. The other thing that's important about some of that music that might have some of the darker stuff that you mentioned, Mathias, is if that's where I am, if that's how I feel, it can be really validating to hear a song where somebody else feels the same way. And so I can actually take that potentially dark material and help them see that they're not alone in this, and help them see that other people have connected.
Right.
And I can also talk about what's happening in the song instead of talking about what's going on in my own life, which may be hard. So I can use that music as a gate to opening the ability to talk and discuss more.
Okay, good. Yeah, because you think about it and you was like using the music, so that part right there was like, some of the songs that you hear even on the radio are kind of like degrading and this and that, and so you're like, well, how can you use that to help somebody recover? But I get it now, because you're using, because there's something for them to relate to, so that does help. So they're not out there by themselves, they're not alone, they feel like, okay, it happened to somebody else and they're getting through it, so I should be able to do the same thing.
Yeah, I can give you back in the early 2000s. I was using music. It would have been 50 Cent, Tupac, people like that. And I remember working with a group of adolescents in a behavioral health facility, and we were listening to some of the music, and we were also reading some articles and watching videos too about the songs. And the concept of misogyny came up, and the adolescents were like, well, I know I've heard that word, but what does it mean? And so we were able to look at the songs and look at how women were being portrayed in the songs, and what that meant, and what misogyny was, because that was a term in the article. And then from there, really talk about, what does that mean for you if you're a 15-year-old adolescent female? What does that mean? How do you want people to relate to you? What does this song saying about you? Are you empowered by this, or is this actually causing harm to you? And so it really opened up a difficult topic, but in a really relatable way.
Right. So I get it. So okay, with working with music therapy, when did you actually start working with therapy, and how did you become a part of the music therapy program at Florida State University?
Yeah, so I did my initial training in the late 90s and started working then. After I finished school, I I started working with older adults. And so I worked with residents who had medical conditions, but also residents that had things like Alzheimer's.
Okay.
So it was in the mental health arena. From there, I actually went into working with child and adolescent psychiatry. And so that was the next step from there. And so we started with children as young as 2, and then of course went up to 18 or 19 if they were still in school. The kiddos that were 2 were not diagnosed with mental illnesses yet, but they were at risk. So most of them were in abuse or neglect situations. And we were trying to prevent some of the mental illness by getting them support services early and early intervention. And then the children and the adolescents had everything from depression and anxiety to schizophrenia and a number of different things as well. And so we were, really helping them develop coping skills. I then went on and worked with some other populations and finally moved into medical. And in medical, I've done some rehab elements where you've helped people do things like learn how to walk and talk again. But I've also done a lot of what we call psychosocial support and psychosocial care. So we worked with patients that had cancer and cystic fibrosis and sickle cell anemia and really lifelong chronic substantial illnesses. And with many of those, you get a lot of mental health issues because it causes a lot of anxiety and depression. And so really helping them navigate not only the illness, but the treatment process through those music interventions is what we were doing. Oh, Joseph, I've lost your sound.
Oh, can you hear me?
Yeah.
Okay. So for me, learning how prevalent anxiety and depression is in America, it's almost the standard when it comes to mental health, anxiety and depression. But also, I think Mathias' screen has frozen a bit, but he'll come back. But looking at a lot of people's environments, looking at the way America is set up, in a lot of respects, just looking at how culture is experienced, how culture is taught and passed down, kind of understand why anxiety and depression are 2 of the most prevalent mental health disorders that people will have. So I'm glad that we have something in place like music therapy to be able to help people not just cope, but help people be able to improve their mental health. Because even going back, when I think about music for myself, I know what I look for in music. I love hip hop music, but I look for lyricism first. I look for being able to be dynamic. Can you tell stories? Can you make sense? Are you telling the truth? You're not just out here just saying stuff because it sounds good. So I know those are things that me personally, I look for in music. But now that you're talking about from a therapeutic standpoint, it will be even more imperative to be more, to pay more attention to what we're listening to in the music, because it could help improve or even contribute to the further degrading of our mental health, depending on how we're exposed to certain types of music.
Yeah, there are definitely unhealthy uses of music. So if you are struggling and you listen to music that reinforces that where you are, that can kind of keep you in that place of struggle. The flip side is that music, if it's used in music therapy, can also be a way to connect and start to move you out of that point of where you're struggling. So there's a balance between using music to kind of keep you where you are in a negative state and using that same music to help you come out of it. And so that's why that training as music therapists is really important, because we have the knowledge and the skills to be able to make really important choices in using music.
Okay. So one more question about that. I kind of want to go back a bit, because you mentioned earlier using music to help someone learn how to walk again. Mm-hmm. So is music therapy, and correct me if I'm wrong, it could be used for mental health, but also to improve physical health?
Absolutely. And it's also used in exceptional or special education services to help students who have difficulty learning concepts to help them learn, because it's a great tool for memory. So
Yes.
one of the wonderful things about music therapy is we can work in a broad range of environments and with a broad range of populations.
Okay.
So hospice, forensics, medical, mental health, school settings, all kinds of places.
Okay. Okay. And that bring it back to our testing event. I mean, our vaccine event. That will make sense to, like we talked about, being able to calm the kids down, but also it can help improve physical health if used correctly. So,
Absolutely, absolutely. You know, the great thing about with the vaccine project that we were working on is music is such an important part of children's lives, right? That's totally normal and totally developmentally appropriate. So it's a great way to connect with them. And it's a great way at that age to distract them from what's happening with the shot they're about to get. So they
yes,
can
Right.
I
focus
saw
on
that.
us and the music and not focus on the shot that's scary.
Okay.
And that makes a much more seamless and less frightening experience, which is really important because if, as I know you guys know, when you have a lot of bad experiences with healthcare when you're younger, you're less likely to seek that care as you get older. And
Yeah.
so if helping them have positive experiences as children leads to them engaging with healthcare across the lifespan, then that's a really important thing that we can do.
Yeah. Yes. Like, but it's amazing because you're talking about different ways that music therapy can be used.
Yeah.
And so now my mind is really, the thought spot is just really expanding and my mind is swirling right now because I'm just thinking certain situations or certain places where music and in the past where music therapy could have been used to
Mm-hmm.
help certain people in certain situations, but I guess the people in the environment didn't really have access to the information about music therapy. But you earlier you talked about the 90s when music therapy was still very very little known in the 90s.
Yes.
So I, I was in high school late 90s early 2000s, so it was still in its infancy as a field, so I can kind of understand that. But now it's has a broader audience and more people know about it, so music therapy can be used even in schools.
Mm-hmm.
Yes, yes. And there are music therapists working in Leon County and some of the surrounding counties as well. So we do have music therapy services, not in all of them, which would be a great thing to have, but we do have music therapists that are engaging in the school systems here.
Well, that's great. So, like in the previous question before, you talked about how you worked with some behavioral and you worked with ages 2 on pretty much to adulthood. So, really, what could you use to determine if music therapy is the best way to treat a patient? Since you worked with everybody from a whole broad span of people from adolescents to adults.
Right, right. Well, you know, as a music therapist with our bias, we say music therapy is good for everyone. But in truth, I recognize that it is not always the appropriate route for every patient or client, just like talk therapy isn't, or speech therapy or whatever. But in my experience, where we've really had the most impact is with patients or clients or students who are struggling with some of the other ways that they're getting supports. So, for example, if a child in the school system is not meeting their goals on their IEP, but they're getting OT, PT, speech, or they're making progress, but it's slower than they would like, often music therapy can be a great addition to help those that are not responding to other more traditional therapies or just need a different way of presenting the information to make the progress that they're capable of making.
Right.
Right.
So you've got that side of it, and then you've got certain disorders or diseases or things where music therapy just really excels. So we know we're learning more and more about how music and the brain interact with each other. And so as we learn more, we're better understand how to use music to address things like Parkinson's disease or those people that have had traumatic brain injuries, and because we can use music to kind of override some of the things in the brain that are no longer working because of the injury of a stroke or whatever.
So I have another question. So with the, since you know saying music therapy is used in a lot of settings now and things like that, and I also know they use like pet therapy and other therapies to help improve the enhancements of people. What do you do in the case that something doesn't work or it's not working for that person? What other steps do they need to go into, or what's the next step if music therapy doesn't work for me?
Right, right. And music therapy doesn't work for every patient or client. A good example might be a professional musician that has had a traumatic brain injury or acquired brain injury like a stroke. Actually engaging in music therapy might be contraindicated for them because they've lost that as their career and as their life kind of passion.
Gotcha.
And it may, from an emotional, psychological sense, actually cause more harm than it would help because they can't engage with it the same way. And that might be frustrating and emotionally painful for them. So there's situations where it doesn't work. And I think that's true with all forms of therapy. You know, some people respond to certain approaches or types of therapy better than others. And then there are some types of therapies that are more appropriate for certain needs or conditions, like physical therapy. If you were having trouble expressing your emotions, you wouldn't go to a physical therapist. If you needed to rehabilitate a hip and knee injury, then that's when you go to the physical therapist, right?
Right.
So really knowing what the need is and what form of support or therapy works best, and then being willing sometimes to refer to others when it's not working, or to collaborate with others. So because sometimes it's not that it's not working, it's maybe you need more than one approach at the same time. So you need a more team-based approach.
Okay.
Gotcha. So one of my question is about, because I thought about different ways that music can be used and the different types of music that can be used, and as far as healing. So I've gravitated toward meditating with specific music, but more so at like a 432 hertz or a different megahertz. So how does, I know the answer, but for the audience, how does listening to music at different frequencies, like the 432 hertz or some of the other megahertz frequencies, how does that affect the body or a person's mental health, those different frequencies?
Yeah, you know, there's a lot of research happening, and there's still a lot we don't know about the brain and how it responds to music. One of the things that we do know is that different people gravitate to different aspects of the music, right? Mm-hmm. And different people have different sensory needs or inputs or concerns with the music. So when you look at what music you're using, we tend to focus on, that's where some of the preference comes in. So you may like a particular sound, right? And so that is going to be more calming because of your preference for that sound than other sounds. You may like a specific volume level,
right?
Or you might have a hearing issues that necessitate a louder volume. So like older adults are going to need louder music because their hearing just from normal aging is not as good as it was when they were 25, right? So adjusting those properties of music becomes really important. The information on using specific frequencies or specific pitches is still really nebulous, for lack of a better way. There's still a lot that we don't know. Mm-hmm. And so answering that from a specific is harder to do. I can tell you some of it also relates to your cultural background and the different uses of music. So Western approaches to music versus more Eastern approaches to music. There's a lot of difference in how we listen to different frequencies and pitches and tones, and that can impact as well, which relates to how your brain is kind of trained to hear and respond to music. And so all of that's going to come into play, the training, the culture, the sensory needs that you have. For example, we often know that children on the autism spectrum struggle with certain types of sounds. So they have sound sensitivities or sensory needs. And so we have to be really careful in terms of what kind of instruments you're using, and there's not a one size fit all. For this autistic child, it might be metallic instruments they can't tolerate those, whereas another child might gravitate to those. So it also, that individual factor comes into play.
Right. Gotcha. Okay. So as far as you have years of experience, you've worked with a number of patients. What are some of the results that you see that your patients will have who've gone through the therapy, actually took the therapy serious? So what different types of results are you seeing from the patients who are engaging in music therapy, rather?
Right. I've got so many examples, and that's the joy of the job, is to get to see all of that. But a really straightforward example is I spent about 5 years doing evaluations in a public school system as part-time, in addition to my teaching and clinical job in the hospital. And one of the things that happened repeatedly is I would go in to do an evaluation to determine if the child was eligible for music therapy services. So in other words, I'm trying to figure out if music therapy would be a good support system for that child in meeting their academic needs. Right. And I lost count of the number of times that I would turn around when we were doing something in the evaluation and a teacher or a paraprofessional or another therapist would be crying. And I would, oh no, what have I done? And they would be like, no, I had no idea this child could do that you're doing with them, because nobody had ever used music as a way to connect with that child before. And they were literally seeing things that they didn't know the children could do because we were engaging in music. I've seen situations where, or even had experiences where family members, I'm thinking of one in particular when a child was in the PICU, pediatric intensive care unit, and mom was just so overwhelmed that we were able to go in and connect with mom and give her the support, as they don't know what's happening with this child. And we did that by engaging in kind of a family music therapy. And then when the child was sedated and unconscious, I was still able to continue to provide those supports for that mom.
Right. Okay.
I've had situations where I was working with a hospice patient, and this was just a matter of weeks before the patient ultimately passed away. And there was a lot of tension in the family and stress and grief. And we were able to go in and do some music assisted relaxation. So helping them do relaxation exercises to music. But as part of that, we did some conversations, and we were able to actually have the family communicate and talk about their relationship with each other when they weren't doing that in an ongoing way because of all the grief and stress and tension. And those moments in music therapy became a really positive experience where they could reminisce about songs they sang to, this was an adolescent hospice patient, songs that they had sung to the child their whole life. And that became something positive in this period of time where there was a lot of grief. And those moments may be small, but to those families, they're invaluable.
Right. Definitely, because you're able to use that music therapy to help a family reconnect, something that they clearly couldn't do on their own. And that's one of the powerful things about therapy is, I know a lot of people look at it because it's stigmatized, and people don't want to feel like they're the crazy person.
Yes.
But going back to something I said earlier, we have to realize the environments that we live in.
Right.
We're exposed to a lot of trauma, whether it's something that is a 10 on the trauma scale or 1 on the trauma scale. We're exposed to, we were just reading this morning about 2 shootings in this area. And so, yes, we weren't a part of it, but somebody somewhere read that and it impacted them negatively.
Right.
So just being able to understand that and why therapy is important, but why music therapy is also important, because it's another avenue of therapy that people can use to help heal themselves and improve themselves, and you're a part of it. So that's great.
Yeah, my hope is that we can get to the point where we treat mental health like we do physical health. You would never stigmatize a cancer patient for going through chemo or radiation. We'd never say, oh, just tough it out. We'd never do that with a cancer patient. So I hope that we get to the point that we can treat mental health needs the same way.
Right, right. You're on mute, Mathias.
Sorry. I actually learned a lot just listening to the parts that I got to listen to. It opened my eyes up to a whole bunch more about different types of therapy. And Joe and I always go back and forth about, in today's society, people really feel like I have issues if I go to any type of therapy, and that is really stigmatized. So, what advice could you give to people who are skeptical about seeking any type of therapy, whether it be mental health, whether it be pet therapy, whether it be music therapy, any type of therapy? What advice, as a clinical person, could you give to somebody who might be on that teeter-totter level to say, I'm reaching right to it? Because Joe said great things, like you can make memories. You can turn the bad to the good and have positive memories to the music. So what could you give a person who's on that fence to be like, maybe I should, maybe I shouldn't?
The biggest thing I do is meet them where they are and acknowledge that it is scary and that there is stigma and that the way they feel about that is normal. That, that hesitancy, that is normal and that is okay. My job is to support you and work with you in a way that acknowledges those and helps you work through them. And then beyond kind of meeting them where they are and validating how they feel about it, really trying to emphasize when they're ready for this to happen, that they're actually the strong one in getting that help, that therapy, that seeking help, whether it's educational help or therapeutic help or whatever help it is that we need, that's a sign of strength to me. Is being able to acknowledge our needs and be proactive and take a step to address them. That's a powerful, powerful statement. And then I think even more important in some ways is the broadly, just we as in our communities need to talk about and advocate for mental health services or therapy services so that it normalizes it. Right. Talk about it in a way that people don't run away from it and make it more normal. And then that'll reduce some of those hesitancies.
Okay. All right. And see, one of the main things here is to take away that veil of,
right.
I don't know what's going on. I'm not sure what's happening. COVID is messing a lot of things up for us.
Yes, yes,
and we can't really do outreach the way we want. So this is our outreach right now. And this was an excellent conversation, Dr. Gooden. Like this was an excellent conversation.
I enjoyed it.
Yes, man. We definitely learned a lot. But one of the main things I'm saying it like this is because this allows us to get information out that people normally would not have access to. Like, no, if I see you out in public, we don't walk around with our professions hanging over our head.
Right.
And so
right.
I wouldn't know just to walk up to you and all the music therapy questions I have to just be able to ask you. So being able to use these mediums to connect and get the information out is great. I appreciate it. And thank you for your time, for your wisdom, your information, your experience. Because I say once again, this is definitely a great conversation.
Thank you. I'm so happy to be here, and I'm so excited about what you all are doing to really be those advocates and educators. That's such an important part. So thank you for doing that.
Yes, ma'am. Thank you. So
thank you.
How could somebody see this podcast and they say, you know what, I need to have Dr. Gooden on here. Oprah sees this or somebody and they want to contact. How could people contact you?
Come on, Oprah. Come on, bring it. I'd love it.
So what's the best way to contact you?
The best way to contact me is my email is just lgooding, so LGOODING at fsu.edu. And you can also go to the FSU web pages and just in the search box, just put music therapy and it'll pull connections to our program up right there.
And remember, her email and the link to the FSU website is also in the description of this video. So you can go scroll on down to make sure you get that. Dr. Lori Gooden. I mean, what more can I say? What more do I need to say?
Thank you, guys.
Thank you. And we definitely look forward to connecting with you again. Hopefully when this COVID calms down, we can be able to collaborate on another event, because I want to be able to see how we can use music therapy to also help us in HIV settings as well.
Oh yeah, yeah.
Yes, ma'am.
Yep,
So
absolutely. And we hope to get back for some more vaccine clinics
yes,
in the upcoming months. So
yes, you're definitely welcome. So thank you once again. Thank you, everybody. Remember, this is Mind Your Body and Soul, the Healthiest Podcast. I'm Joseph Ward. He's Mathias Sweet. She's Dr. Lori Gooding. And remember, we're available every Wednesday on our website at www.nmcpodcast.com and our parent website at neighborhoodmedicalcenter.org. We're available on Anchor, Breaker Radio, Public Pocket Cast, Spotify, Google Podcasts, and YouTube, the healthiest podcast you have ever heard in your life. We will see you guys next week.